Thanks, Brandis. You might be surprised to hear that opioid overdose deaths for older Americans are soaring. Between 1999 and 2019, the number of people 55 and older who died from an opioid overdose surged almost 1,900%. And that's from a little over 500 deaths in 1999 to more than 10,000 deaths 2 decades later. And also disturbing is that older black men were found to be 4 times more likely to die from an opioid overdose than other older adults. Those are the findings of a new report from Northwestern Medicine. And joining us now to discuss this report is Mary Ann Mason, Associate Professor of Emergency Medicine at Northwestern University Feinberg School of Medicine. Thank you so much for being here. So we read off those startling numbers. What is behind this enormous rise in opioid overdose deaths among Americans 55 and older?
Well, part of this, thank you, Paris. Part of this is older adults are just like other Americans in that we are in the midst of an overall opioid epidemic. And so as the numbers are increasing for the general population, so they are for the older adult. I think one thing that surprises many people about this is that older adults indeed do suffer from opioid use disorder and do die from opioid overdose.
And what accounts for black men having a 4 times greater chance of dying of an opioid overdose than non-black men?
That is, I would say we don't know the complete answer to that, but we have some ideas that need to be investigated. I think we really have to look at the social determinants of health on that. And if you look at black men in America, their experiences are often traumatic, are often in communities that are under-resourced. They're often disproportionately involved in criminal justice environments. So those experiences are likely to contribute to drug use in ways that are disproportionate compared to other populations.
And when you parse out...
And you also, I just want to point out,
Sure.
Black men are under-prescribed opioids for pain in medical environments. So there's an element of untreated pain out there for that population as well.
And that was going to lead into my next question. How much of this is illicit opioids that are being used versus folks that get prescribed opioid medication for pain?
That is the crux of the issue, as far as I'm concerned, is understanding that breakdown, and we don't know the answer to that. I have some ideas, but that's part of our next batch of research. I do think that older adults have very good reasons why they may be medically prescribed opioids, but we also know that there's illicit opioids out there in this population as well.
And we mentioned 1,900% increase over the last 20 years. Does that compare to other classes of Americans, other age groups?
Like the general picture of opioid increase in the opioid overdose death increase in the United States, it is in line with some of that. But the concentration since 2013 in this population has really shot up compared to other populations.
And you cover 1999 to 2019, so of course that's before the pandemic sets in. And given everything that's happened, emotional trauma, depression, loss of job over the last 2 years, would you expect that number to be up even more now?
I do expect it to be up, and I've had the opportunity to look at some early 2020 data, and it is up. I'd like to know more about what's happening with the older adult in 2020, because there's a lot of things that could be contributing to that.
Is there a specific policy prescription to deal with this, especially among those 55 and older?
I think there's 2 or 3 things we could be doing immediately. One is increased screening of the older adult for opioid misuse. A part of how ageism works is that we assume older adults may not be using illicit substances or misusing prescriptions, and we really need to throw that idea out the door and screen universally to identify people so we can connect them to treatment. I think that's probably the first and foremost. The other is adapting treatment to the needs of older adults, and it could be as simple as making them treatment centers accessible for people with mobility issues and adapting treatment services for hearing and vision impaired persons, and also offering services in a way that are sort of culturally acceptable to the older adult. And one example of that is group therapy, which studies have found is less acceptable to the older adult, probably because of some cultural ideas about sharing experiences, feelings, and trauma in a group setting.
And could sort of this ageism be part of the reason why that number shot up so much over the last 20 years, that before 2000 perhaps medical providers weren't screening older Americans for opioid use?
Right, and I think it continues to be a problem. We are evolving as the proportion of older adults in the United States grows, but we're in no way in a place where we have thrown ageism out. So there are still providers out there who are not screening because people are older and they assume they're not using. So we need to really start to look at older people as, kind of fully human in a way that could expose them to some of the negative things.
All right, very interesting study, Marianne Mason, and as I understand, more research to come on this, and thank you very much for joining us.
Thank you.